Welcome, everyone. My name is Katie Drasser. I'm the CEO of rockhealth.org. I have the privilege of moderating this panel today on investing in youth mental health. Over 50% of adolescents experience a mental health disorder in their lives. That means basically every single person on this planet feels this issue, whether it's you yourself or someone you care for in your capacity as a nurse, a teacher, a parent, what have you. There are many reasons for this rise, and certainly I would say technology has contributed to that, and I really appreciate what the Surgeon General, who I think is here today, his wise urge and call to action around social media. And yet, there are solutions where technology and other innovations can actually change this, and we're seeing some of that promise already. That rise has been pretty impressive, and huge kudos to not just the entrepreneurs and the innovators, but a ton of philanthropists and investors who've gotten in it. We ran some Rock Health data from our venture database recently, and over the last 5 years, so 2018 to 2023, U.S. digital health's top funded clinical area has been mental health broadly. That's $12.8 billion going into these startups and into these innovations, with $4.2 billion of that being to youth mental health innovations. That represents 249 investors, over 130 deals. That's a lot of activity. There's a lot we should understand about that. So we owe it to each other to explore that, to better understand where technology and other solutions can actually curb this tide. So let's jump in. Much like many of the leaders, we know many folks in this room, who I see in this room, every single person on this panel wakes up every morning and wonders what they could do to make the mental health of youth better, every single one of them. So for each of you, starting with you, Ashley, can you introduce yourselves and your work, and then one grounding fact, something you know about adolescents, about youth, that's important for us to understand the kinds of innovations we should be building and paying attention to.
Absolutely. Well, hi, everyone. My name is Ashley Edwards, and I'm the founder and CEO of MindRight Health. Our mission at MindRight is to make mental health support radically accessible and inclusive to the most marginalized communities. And we do that by really meeting people where they are and providing non-clinical options for support, mainly non-clinical mental health coaching via text message for low-income families and communities. And just to ground context here, right in 2022, it was reported that 70 to 80% of BIPOC youth were experiencing feelings of anxiety or depression. At the same time, 50 to 60% of African American youth and Latinx youth drop off after the first treatment of therapy. So something is not working. I found at MindRight, and my team and everyone on this panel works hard to ensure that we are creating solutions that actively are meeting the needs of the communities that we serve, and most importantly, in my context, marginalized communities. And so one other statistic I'll share before I pass it is that right now, less than 15% of all mental health providers identify as a person of color. And so we look at the disproportionate impact of trauma, of various mental health disparities on communities of color, and at the same time, the industry, right now we're seeing there's a huge opportunity to better meet the needs and provide culturally sensitive care.
Amazing. Hi, everyone. I'm Solomé Tiabo, founder of Behavioral Health Tech, which is the largest community focused on expanding access to mental health, substance use, and autism and IDD care through technology, health equity, and innovation. So, of course, I'm very excited about this panel. Thank you, Katie, for organizing. Now, I had to write my stat down. So, nearly 4 out of 10 U.S. employees have children who are minors, and 53% of parents have missed work at least once a month to deal with their children's mental health. That tells me that the demand for innovative solutions at payers, health plans, and employers alike is not slowing down anytime soon. And the type of work that Ashley and so many others are doing is really so critical.
Thank you. I'm Margaret LW. I'm President and CEO of Hope Lab. We're an impact investor, research organization, and innovation lab, and we work to support and invest in the mental and emotional well-being of young people. We have a specific focus on reaching those most marginalized and underserved BIPOC, LGBTQ+, and other underserved young people. And we are proud investors in MindRight and partners of Behavioral Health Tech. I'm going to talk a little bit more in a few minutes about the broader sort of picture of innovation in the mental health for youth landscape. But the statistic that I'll throw out today is that 25% of 14 to 22-year-olds have used online therapy, 15% in the past year. So when we think about the kind of landscape for innovation, the need for innovation that really meets the linguistic and cultural needs of young people, it's a big market.
It is a really big market. And in fact, it's vast and it's dynamic. And we often hear, okay, we need more philanthropy, we need more investment. Most people are pretty convinced on this issue. People are pretty committed to the cause. What we often hear from the public sector, from investors and philanthropists, is what do we do with our dollars? Where should it go? How might it ladder up to systemic change? What's a vision we could all hold that would actually not just be little tiny incremental changes, but create vast change across a whole bunch of people? So Margaret, back over to you, especially with the work you do. How would you describe the opportunity landscape and how we hold? It's a complex space.
Yeah, and I appreciate that. I want to just start. I was actually in the last mental health panel. I suppose a lot of people in this room probably were. And one of the things I want to emphasize is that today we're going to focus a little bit more on investment and specifically private sector investment in technology-based or service-based companies. But the investment with a small I here is a really broad array of things, from a lot of government investment. We talked about some of it in the last session, a lot of investment by philanthropy. We, along with a group of other foundations, with 30 plus participating foundations, have just commissioned a study to really look at where funders, and these can be funders ranging from, foundations, corporate foundations, family offices, celebrity foundations, are investing in youth mental health through grant making. And we will be able to share that, so we'll make sure that that gets out to folks. But there's that whole piece of it, which is how are we doing grant making and investing in nonprofits to really help create services and opportunities in the space. There's all of the governmental funding. In the last session, Dr. Levine talked a little bit about, and Tom Insel as well, about the community behavioral health centers. What we're going to focus on more today is investment in private sector companies. But I wanted to just start by saying, by no means is that all we think about when we think about investment. And the work that I've done across my career has really been at the intersection of public, nonprofit, and private sectors. So what I would say about almost everything we're going to talk about today is that it takes players and actors and really passionate people in all of the sectors to create companies that are sustainable and viable and meet the needs of young people, particularly those who are most often marginalized. So I wanted to start out just with a few statistics from a report that Hope Lab, which I represent, and Common Sense Media did with NORC, that we just have been releasing over the past few days. We'll have links to that for folks later. But the statistic that I offered, about 25% of 14 to 20-year-olds using online therapy, comes from that report. We also know that 54% of young people have used a mental health app. And if we break that down a little bit, 62% of women, 44% of men across the board, but 64% of Latino respondents have used a mental health app within the past year. We have from a couple of other studies, the Making Caring Common study done by Harvard University, looking at 18 to 22-year-olds. 56% said financial concerns and 51% said achievement pressures really impact their mental health. 58% said that they lack meaning and purpose in their lives. So when we think about the work that we need to do to invest in this landscape, there really is work across everything from serious mental illness and really clinical interventions to things around purpose and meaning. We've got some work going on with others in the room in that space. So the landscape is vast, and there's a lot of both need for innovation and opportunity for innovation. Finally, I think one other statistic that I'll offer is from the Trevor Project. 41% of LGBTQ plus young people seriously considered attempting suicide in the past year. And so this is something when we think about, and when Ashley's work and a lot of the work Salome does focuses on marginalized populations, we really do focus on how we can both invest in and create solutions that can work for populations that often need something a little more tailored and a little more specific. So I'll sum up this little introduction by saying it's a big population. We're talking about 10 to 12 million kids in the 14 to 22 age range. They're online. They're looking for health and mental health services online. They're using online therapy. It's being provided both by their traditional therapists as well as by newly emerging startup companies. And we want to just talk a little bit to some folks who are active in the space to learn more.
And Salome, you probably know every innovator in the, since you hold the largest community around this work. Will you build on what Margaret said, but also offer us a couple concrete examples?
Mm-hmm. Yeah, I mean, so many great points. One thing before I forget, Margaret, you talked about the last session. Dr. Inzel mentioned CCBHCs. I do think there's a lot of opportunity for our worlds to connect a little more. The digital VC-backed innovation worlds, at the cutting edge, they've got the resources, they've got the tech to really make a scalable impact. But a lot of the community-based organizations, they're the ones who are reaching and engaging young people. And I do think there's a lot of opportunity that we can do as an industry to better bridge that divide. But yeah, it's an exciting time for digital mental health. I reference the Rock Health report almost every year. It's at the top of the list is digital mental health funding, which is so important because I would agree that just as the last session had mentioned, while the pandemic is over, unfortunately, the impacts are still affecting our young people. And so, yeah, I've been excited to see the various models. Without stating the obvious too much, we are in, of course, such a dire shortage of specialists, particularly those that can tailor their services to LGBTQ teens, adolescents of color, just as MindRight has done, adolescents. And so I am so optimistic for the opportunities for technology to be able to scale that support more broadly. And so some of the solutions I've seen have been organizations that have partnered with schools because, again, reaching and engaging youth is tough. Hope Lab, you've done a lot of work in that space, and we need to meet folks where they are and where else but where they are so many hours of the day. So it's been exciting to see companies like that. I think Hazel Health was one that presented last year as a good example. Another one that I've been impressed with leverages a very large teen advisory board, like 300 of diverse backgrounds, to be able to build the solution at every step of the way. And that is just so critical. I've seen a lot of adult-focused behavioral health companies try to jerry-rig their solution to try to meet the needs of adolescents, and it just doesn't work. They need their own tools that are built for them and by them. And so it's exciting to see when companies do that kind of work as well. Yeah. So that's just a few.
And Ashley, MindRight's an award-winning example of this, and you built it started first in your own community. Can you tell us a little bit about, the opportunity you see and why you have a lot of investors behind you and a lot of other payers like Medicaid? Why are they saying yes to what you're building?
Yeah, I think it's a lot of what both Margaret and Salome were referencing. MindRight was built for our communities. It was intentionally created. And I think right now there's a lot of amazing innovations happening in the space, but not all are built to meet the unique needs of marginalized communities. And equity cannot be an add-on service. You have to build and design your product specifically with equity in mind. And that's why at MindRight, we can say more than 90% of the people we serve identify as BIPOC. And we retain them for much longer than industry average. I mentioned that drop-off for mental health is typically 50 to 60% after one single therapy session. Our most active users have been texting MindRight almost every single day for 5 or 6 years. So when you design intentionally for communities, with communities, those are the type of results that you can see, and I think our work at MindRight is a testament to that.
And you're covered by Medicaid in the state of New Jersey and just recently now in Washington, D.C., is that right?
Yeah, so in addition to the majority of our members identifying as BIPOC, also the majority of our members are Medicaid eligible, so we have partnerships with Medicaid plans in D.C., Florida, as well as a commercial plan in New Jersey.
Great. It kind of begs a lot of questions, but one of them, your model is unique, effective. There's a lot of questions about what's the right model to reach. You have the payer over here, you have the caregiver over here, you have a kid over here that, like, as somebody said in the last panel, doesn't pick up the telephone ever. It's on their phone. Margaret, from your perspective as an investor, you do many things. Investor is one of your hats. What are you paying attention to in terms of outcomes, in terms of how you spot something being successful with this sort of sea of activity? How do you know what's actually working?
Yeah, that's a great question. So Solomé just referenced school-based telehealth, and one of the things that has been really interesting is 17% of schools now have school-based telehealth for mental health. And one of the things that we noted was that over the past, in 2023-24, those programs garnered a huge amount of investment, hundreds of millions of dollars, but also brought in about $500 million of federal funding alongside. So one of the things that we're looking for is a viable, sustainable business model. And that doesn't mean, you know, a huge profit margin and nothing else. It really means we want to see companies or help companies evolve to a place where they have a set of payers. I mean, Ashley's company, MindRight, is a great example. They have a set of payers like Medicaid, government programs. They often have grant funding coming in to fund things they're doing. But so one important piece is there a sense of who's going to pay for this, and how are we going to make sure that we help build and scale something that can stay viable? Because if the companies are not viable, there's no mission met, right? No margin, no mission, we've heard. The second one we always look for, and these folks have talked about it, is engagement of young people in the design, testing, development, and rollout of the company. So we're actually looking at Hope Lab to invest in underrepresented founders, but we're also keenly interested in companies that engage young people. We don't believe that you can have a good company in this space if the founders don't engage young people. You know, partnerships, we talked about school. I think this is an area where partnerships are so key. So when we look at a company, we really look at the ability of that team and the investors that are gathering around the table to be willing to actually work a little harder at partnership than a lot of other companies have to work. It's often challenging. There's also the ability to sell to multiple parties. It's often a parent, a school district, a young person, and so we think a lot about that. So there's a lot of dimensions to think about. What I would say a couple of the key takeaways are, and folks in the room who are involved in this know this, the companies that address serious mental illness or more clinical conditions where there have been historical payment models and where they've brought innovation to make it more accessible, more convenient, or more affordable, are doing well. They're getting customers, they're getting traction. It's much more challenging on the upstream preventive side. So, you know, again, one of the things we think about as an impact or mission investor is how can we try to help some of the things like Ashley's peer-to-peer support program, or communities to support LGBTQ young people, or communities that support the whole family in mental health. How do we actually help them develop sustainable business models? So I would say that's the biggest challenge in the field right now.
It's huge. It's huge. And Solomé, you were referencing sort of where the demand lies, and part of it is among, you know, employers, payers, et cetera, are really paying attention to this because it's affecting so many people. They're paying the costs of the problem. And so they're curious. How do you work with so many payers and large enterprises in the healthcare space? What are you hearing from them? What's drawing them in? What's giving them pause?
Mm-hmm. Well, one of them, you made such a great point, Margaret, this idea of the role of philanthropy in this space. Mm-hmm. You know, payer, they might understand, wow, this novel solution makes a lot of sense. This is what the next generation needs and is asking for, but perhaps they don't even have the mechanism to pay for this thing yet, and they're not in a place to be able to take that kind of risk. And so there's a real big opportunity for philanthropists to support those novel solutions where there's not a totally exact CPT code or whatnot, to be able to prove it out and then go say, hey, look, this is actually what this community needs. It works, and so that they can get scale. So that's certainly a really big key takeaway I would love the philanthropists in this audience to know about. And so for payers, over the last several years, there's just thousands of these solutions. It's so overwhelming. And I think one buzzword that we hear a lot in our space right now is measurement-based care. I think the onus is on the innovators to be able to demonstrate how they are driving outcomes, how do they compare with their peers. But also, I think payers are equally overwhelmed with, when it comes to building out their portfolios, now we're at a place where a lot of the easy stuff has been done, and like tailoring solutions for Medicaid or SMI. Now we've got startups that are focused on just obsessive compulsive disorder or just eating disorders. And as somebody who comes into this space not as a technologist or a clinician, but really as an anxious teen that struggled a lot with obsessive compulsive disorder, it took me years to finally meet one other person who also had OCD. And it was the 2016 International OCD Foundation Conference where I was like, oh my goodness, I am not so strange. I'm not so unique in these obsessive thoughts and compulsions. And now there are apps that recreate that experience online. And it's so exciting to see more specialization. But then going back to the payers' needs, now it's like they've got so many solutions in the portfolio addressing these specializations. They have to think about how are these solutions going to coexist with one another. And I think I'd say the theme of this year for our space should be partnership, and how are they integrating with one another, how are they working together, and so I hope to be able to contribute to that kind of activity.
You already are.
One thing I left out that I would love to hear Ashley talk about is engagement.
Yeah.
Because as probably most people in this room know, there are, to Solmei's point, hundreds and thousands of solutions that have been developed. Very few have been able to get really significant engagement from young people. Ashley has. So what could you say to us about that?
Yeah, so many lessons here. I think one thing I often think back on is when I was first starting MindRight years ago, and again, the basic premise is providing mental health coaching, proactive mental health coaching via SMS texting to low-income youth and families. And when I first shared that with a lot of investors, the first feedback I got was, you need to make a chatbot. And then that will make this scalable. Every investor meeting I had, I was rejected because they wanted to see a chatbot. But I stood firm because I tried to explain, after working with hundreds and now thousands of youth and talking to them, none of my youth want to talk to a chatbot. In fact, I can't tell you how many people text us saying, hey, you're a real person, right? And I think that's just a lesson where there's so many in building MindRight to have the engagement that we have right now. It's been lessons again and again that adults cannot determine what an intervention looks like or what healing looks like for youth. Only the youth can determine that. Okay. And because we kind of bypassed our own biases, our own assumptions, we were able to get to a product that actually makes sense for youth. And even in some early conversations I had when I was pitching MindRight to schools, to payers, they're saying, oh, people will never text a stranger. Kids won't do that. And then the same kids they're talking about are texting us essays every single day because no one else has bothered to ask them how they feel. They don't feel comfortable or vulnerable enough being able to share their true emotions face-to-face with people. And so we become that outlet where they are safe, where it is faceless, and they can have that. And they're able to build a long-term relationship with not a different person on a hotline every day, but they have one MindRight coach who they talk to every single day for years at this point for a lot of people. And that has allowed us to build trust, to also share power with the people we serve because we put them in the driver's seat. And also, again, just build this consistency that unlike other systems, unlike other adults who may have abandoned you, may have walked away, may have promised something, and then ultimately you don't get that. With MindRight, we text them 7 days a week, every single day. As long as they stay with us, they can leave, come back. Our job is just to be ready when people need support. That's it, to be ready. And I think that has just allowed us to build the type of relationship that we have with our user base where they feel they trust us to engage, and it's a privilege for us to be those people for them.
And it sounds like, I've heard you before, Ashley, talk about it. It sounds like it really matters for many reasons, but one is often when kids have, an acute episode, an episode or in crisis, they feel very alone.
Yes.
In this case, they're already connected. They're already right there, which is part of the engagement that you've really cracked the nut on something that I think a lot of people, to Margaret's point, have not quite figured out what kids want. I don't know, Margaret and Solomon, if you want to add, what more do kids want when they're seeking mental health? We're going to come out to all of you soon, too. But what more are they looking for? How are they looking to engage differently? Where are you seeing upticks in engagement and traction?
Yeah, one thing I'd love to emphasize that, Ashley, you really also pointed out is having sophisticated enough investors in coming into behavioral health. They need to be patient and focused on quality over tech returns. Otherwise, bad things will happen. So that's just a really great example. This is one example I talk a lot about in sessions like this is during the pandemic, I had an opportunity to run a philanthropic fund for Melinda French Gates' personal investment company, Pivotal Ventures, and we funded 100 youth mental health organizations nationwide that focused specifically around LGBTQ teens and adolescents of color. And one use case that came across was funding a grantee to offer video sessions at home, and we're finding that they weren't using them. And wow, imagine that. We thought to actually go back and ask the teens, maybe we should have talked to them a lot sooner, looking back, to help actually drive the solution. And they were saying, well, as an LGBTQ teen stuck at home, not at school, I'm not comfortable using video therapy because I'm not out yet and my parents are next door, they can hear everything, and would much prefer a text-based solution like MindRight. And that's just one of so many examples where if teens were at the table to help drive the solution, we wouldn't even have to have wasted that time and resources to get to that point.
Yeah. I mean, one thing I'll add is a simple but really, really hard one, which is trust. And it was interesting. I was looking through some statistics, and one of the things that came up, a lot of the Surgeon General's report, a lot of concern about what is coming at young people online, how much time young people are spending online looking at health information. The statistics on how skeptical and how eager to test out and cross-reference things online it was over 80%. 85% of young people say, at least in the survey we just did, that when they get information online, they test it, they check it, they vet it. And I think that thinking about different ways that the companies we work with, the online, presences and organizations establish trust is a really important one. One other example, I was thinking, the previous panel was talking about 988. And a guy we work with, Rob Morris, who has a platform called Coco, did a bunch of testing of messages. And if you're sitting and it said, you're looking at something and 988, are you in distress, call 988 pops up. Guess how many young people think that's a really welcoming message? So many. So Rob tested a bunch of different messages with young people about what is most likely to get somebody who's in that moment to engage. And there were a lot of messages that were really good messages. And so I think that this work that we can do using technology of rapidly testing and iterating around what it is that's helping a young person feel met, feel trustworthy, and feel safe, I think is incredibly important.
Go ahead, Solomon.
I can't remember who was in the last session that said by age 14, the young people have more discernment around.
Probably Lisa. Was it Lisa, Tom? Yeah, Lisa DeMore. Yep.
Yeah, that's eye-opening. So.
We know from some of our data that, how you build trust is really important, as you're saying. We know this and so most people in this room know this, how you do that. And if you're an entrepreneur, anybody working in a space, and you go up to somebody, I'm trying to build your trust, you will lose it so fast. How you actually build trust is hard. And I think when I look at and learn about folks like you, Ashley, and a lot of the other folks that have been mentioned, we assume that sort of all entrepreneurs are just sitting in Silicon Valley, not a part of communities. Most of the folks, I know some of the investors in this room, I know some of the entrepreneurs in this room, by the way, they might be in Silicon Valley, but they're also in their own communities building solutions. So I think there's also a little bit of a misconception that like only community-based organizations are actually reaching communities. There are so many cool entrepreneurs in Tulsa, Oklahoma. Just asked our team. We go there all the time. We love those folks. In Detroit, in Minneapolis, in Atlanta, we're there. And I know many others here who are not just in one city building solutions for people far, far away. And so I think from an investor standpoint, we just made an investment, Rock Health Capital did in a youth mental health company. We're looking for like this design question, where is this being built, by whom, for whom, with whom? It's really important. And I think it sort of gets at this trust thing. And I don't know if you can share other examples of like how else we can build trust without telling people we're trying to build your trust, because you will lose it. But where else you're seeing the trust kind of start to build back up? It's a problem way beyond mental health, way beyond tech. It's a problem in our country. But where we're finding little kernels of trust popping up.
Yeah.
I mean, it's currently been here, but say more.
A simple thing is, at MindRight, we asked them. We did one-on-one focus interviews with hundreds of youth, and one of the questions was, how does someone earn your trust? And we sat and we listened to hours and hours of responses from 13 to 19-year-olds in Newark, New Jersey, Anacostia, D.C., and many of those youth told us, no one has even bothered to ask me this question before.
Yeah.
And that's the first problem. And so they were now, if you imagine, they're sitting across from me or someone on my team, and they're now given an opportunity to tell their story and their needs, and we are sitting at attention. And so that was really how we learned. A lot of people said, one, you don't leave me. You don't abandon me when it gets tough. You don't judge me. You don't police my language or behavior. So these are all different things that led to just developing MindRight in a way where you can really, the user can be themselves, and as opposed to us moving to what we expect of the user, we move to what the user expects of us. So you can talk slang, talk how you want. It's the coach's job to understand you, not the other way around. And so it's just it's things like that.
Yeah.
I love that. Well, one thing we have, along with 12 or 13 other funders, created something called the Responsible Technology Youth Power Fund. There are some other funders of it in this room. And the purpose of that was actually to give funding and investment to young people, youth or intergenerationally led nonprofits in this broader space of responsible technology, youth mental health, the intersection of AI and mental health. And we've heard over and over again that this willingness, and I'm not tooting our horn, this is 12 or 13 organizations that have joined forces to do this, that the willingness to actually invest directly in young people also is an important trust-building factor. So when people can see that you as a philanthropist, or you as an individual, or you as an organization have actually been willing to take the risk to invest directly in young people, to develop solutions or contribute to solutions for their generation, that's been, I think, a huge trust builder. And, boy, have we all learned a lot.
Mm-hmm. We're going to go out to the audience. If no one's ready yet, Solma, you want to add anything to that? But I'm looking for hands.
Katie, you were starting to talk about it, in fact, this idea that it's not only the founders are reflecting the communities, but the investors are also reflecting the communities.
Yes.
It really is the whole spectrum. And so still a lot of opportunity to diversify the funders, the LPs, by a long shot.
By a long shot, by 98%, just to be precise.
Yeah, exactly. 99.9%.
99. And the pink hat.
Wow. I hear the voice. I don't.
Yeah.
See the person.
Pink hat. Oh. AI. Yeah. Stand up and.
Yes. Hello. I'm curious. You just mentioned AI. And I'm curious
I'm personally excited, but of course have concerns with AI. There's a lot of opportunity in the mental health space. For example, it can be used to detect long before humans can, the perhaps suicidal ideation. Other solutions are using it to evaluate if providers are using evidence-based treatments. So I think we're just at the beginning of it, but like a lot of industries, there's a lot of questions, like who's building it? So yeah, we're really at the beginning, I still think.
We've seen in our recent investment in Marigold Health, we've seen AI be used to support peer coaches with folks on their recovery journey. So, you know, you hear all this talk, AI is taking jobs. This is supporting folks in recovery to help other folks get into recovery. And the AI underneath the peer counselor just gives them little flags and tips and tools and tricks to equip them to do their job better. And they're very early days. They've reached 2,000 people, but with 98% effectiveness. Because who does that person trying to recover trust? Someone who's been there. So that's an example. There's certainly all the cautions and the bias and all that, but that already exists, it turns out. And more questions. Beto, in the back. Hi.
Hey, thank you. So I think one of the subtexts is that a social impact entrepreneur and a traditional nonprofit program grantee look remarkably similar, except for their tax status. When you think about the opportunities that social impact entrepreneurs are creating, and you then think about the opportunities that traditional philanthropies and foundations have had in being able to access those opportunities, rather than just the programmatic opportunities that organically come to them, what's been the evolution of MRIs and PRIs, maybe Margaret for you, but for maybe Ashley and Sloan, in being able to activate the total endowment that these philanthropies have to really start putting their whole mission investments towards opportunities like this?
Yeah, I mean, we've been really excited to see others come in. I was working on a kind of digital health broad PRI fund or mission fund before HopeLab, which is specifically focused on this issue. And we're seeing people come in. I think there's, the traditional philanthropy still has a lot of trepidation about investing. And one of the things about these kinds of investments is they're almost always done in conjunction with either tech or health VC firms. And so you have to be comfortable in that space. You've got to, I think, form partnerships really thoughtfully. You talked about this. But I do think when I think about when I first started doing this in my prior life, the big thing that I was trying to do was to help take these really important innovations to scale. And giving individual grants to university-based research centers almost never was achieving that. And so I think there are certainly challenges and compromises, but I think this financial vehicle and way of funding social entrepreneurs really offers the potential for a level of scale, and we're starting to see a lot of examples of that. So I would say not culturally easy to do within a traditional philanthropy, but I think extremely rewarding and very powerful when it can be brought to bear.
Yeah, and from the founder perspective, I actually originally founded MindRight as a nonprofit many years ago, because at the time I didn't have enough confidence in the impact investors that I was meeting, that if I would have gone the VC route, I felt like at the time I would have been pulled away from my mission. Now, I would say the landscape today is very different, which is why I felt comfortable making that transition. And it's also allowed me now, where Margaret has mentioned this, MindRight as a for-profit social enterprise have received both VC funding and grants. And I think that blend is what allows an intervention like MindRight that requires a level of patient capital to be able to be successful, so that we're not rushing into building interventions that could potentially harm our communities just due to pressures that founders or companies may feel to get results immediately by cutting corners. But I feel really grateful with the investor group that I have that's doing that. So I know it's not easy on the philanthropy side to make those investments in for-profits, but I've seen groups make it work, like HopeLab. I've seen American Heart Association, Iconic Capital. And so I think taking that risk has been worth it, at least on the founder side, to be able to have those types of partnerships, because I think that is the future moving forward. If we really want to see more of these socially minded interventions continue with the backing that they need to be able to really test and iterate on their solution for communities.
And one soapbox I always have, so I'm going to throw this in, Beto, because of your question, is that it's very, very difficult often, given the markets that these kinds of innovations are selling into, to do this with investment capital alone. Mm-hmm. There often need to be grants that actually help what I sometimes call the receptor sites, or the parts of the system where we're trying to have these innovations take home or take lodge, to be able to do that. And so I think it's really important when people in philanthropy want to invest, that they also really think about bringing their philanthropic networks, resources, and capital to the table as well.
Right here in the front row, with the red.
Right here.
Mm-hmm. Yeah.
Thank you very much. This is quite an exciting forum, and it came in because of the work I do back home in Nigeria when it comes to youth mental health. And Ashley, you've been making, your discussion around how you set up and how, you insisted that it's only text. You don't want to go to any chat box. That really resonated with me. And the fact that, youths have to give the solution that they want, not like making them look like small adults. Children have to be children. They are not adults. Mm-hmm. And the fact that, your own solution is more of the text, I'm just kind of looking at other ways. I'm from a different climate whereby text message, you pay. Mm-hmm. So would they want to pay for that, right? And all that. Secondly, the fact that WhatsApp, have you looked at in a way where from text is scaled up to WhatsApp? Mm-hmm. And then I just went to your website to read about things that you do, and it's basically more of the coaches and all that. So I'm taking these steps back to sit and say, a child or a young person sends a message, I'm suicidal. Mm-hmm. What do your coaches do? Is there a transition from the coaches to the real clinical people to do that? The second aspect of it is that by the time a coach is in contact with one of these kids or young person, and it gets to a stage whereby he or she needs to leave that environment, is there something, are you working with people in the ecosystem to also ensure that it's not like you're trying to separate that person from the family, but there's that toxicity there, and that the solution you're bringing on board actually needs that holistic view. Is it part of your plan? Is it scalable? Is it something you're already doing? I would like to know, because I want to.
If MindRight wants to go global.
She wouldn't be the first one.
Yeah, I really appreciate your question. And actually, we've been exploring international partnerships across Africa, Asia, and Latin America right now. So I'd love to just talk to you. But to answer some of your questions, for safety reasons, none of our coaches are ever coaching alone. All of our coaches are supervised in real time by a licensed clinician. And so that clinician is giving them guidance on how to respond in certain tricky scenarios. And if there's ever any safety concerns, that's when the clinician would take over the conversation and help to de-escalate and stabilize that person, call them if needed. We also have different procedures for when we would involve mobile crisis, when we contact the emergency contact, so we request current address and emergency contacts with all of our users for those scenarios. But one thing that I didn't touch on is that we've realized from doing this work with MindRight, since we're texting people every day, we become kind of the frontline mental health support for them. If they change their apartment, if they lose their house keys, we know everything that happens in their lives. And so that has put us in a position where we've been able to really be a super strong bridge for care coordination. So we actually have our own internal care coordination team, where it started off thinking, okay, if similar to your scenario, if someone needs more intensive treatment, if someone requests a therapist, we can help connect them. But now it's really opened up to everything. We have members who ask their coaches if we can help connect them. Like, hey, I'm previously incarcerated. Can you help me find a job? I need help filling out the FAFSA. Can you help me find a free Wi-Fi during COVID because I need to take my classes online and my mom didn't pay the bills? Things like everything comes up. And so we're able to then, like I said, just connect them to those resources, which has been really fantastic. And then you mentioned WhatsApp. So yes, so as we've been having some of these exploratory conversations in different regions of the world, both WhatsApp and Facebook Messenger has come up because we see that depending on where you are, it's not SMS, it's WhatsApp, it's not WhatsApp, it's a Facebook Messenger. And so we are looking at being able, again, with meeting people where they are, that would require us to then adopt our technology to build on top of wherever people are. And so that's something that we absolutely would do. Yeah.
Right here. Right here and here. We're going to take two at a time. Here and then to you, and then we'll answer.
Hi, my name is Elise Blocky, and from Denver. We work at a public health consulting firm, behavioral health awareness campaigns. We're doing a statewide campaign here in Colorado on raising awareness on the high concentration use of cannabis. And there's research is showing a rate for higher psychosis and suicidality. And so preventing that is key. How do you engage your target messaging or you're doing your testing to really get in what's going to work with MindLab and Hope Lab with this audience? What are some of your most effective techniques and tools you've used?
And right here, and then we'll answer. You can decide.
Hi, I'm Desmond Lewis Edwards. I was in How to Dance in Ohio, the musical on Broadway. And our musical focused a lot on autistic individuals and autistic actors playing autistic characters. How do you guys balance not infantilizing the youth, but also empowering them and treating us like, as the young adults that we are? How do you balance infantilization and that? Yeah.
Yeah, I can start with that question. So one of the values that we emphasize in our coaching framework is honoring self-determination for everyone that we serve. So that means if we're coaching someone and they're engaging in activities that we don't think are the best choices for them, but they do, yes, we want to guide them to what we believe are healthy, positive coping mechanisms, but it is not our place to instill judgment on those decisions. And then this is also part of the healing process, that each of us has responsibility and ownership for our lives, and so that self-determination plays a critical piece, and I think a distinguishing piece, and kind of what sets the engagement apart, by just letting our members know, like, no matter your choice, if that's the direction you're going, we will support you and make sure you're safe at the same time. So that's one thing I can say. Yeah.
You want to say anything about cannabis or youth?
Just real quick, from the industry perspective, it's been so exciting to see the innovation and investment into novel autism startups. That's been, talk about earlier, the digital divide for community-based organizations, IDD organizations that have been without resources for so long to even be able to procure anything beyond an EHR, if at all. And so I'm very optimistic about what's happening with that, with funding in that space.
Yeah, we haven't done cannabis-specific work, but we did a lot of work on vaping over the past few years, which is analogous and often involves cannabis. And one of the things we learned, it's very consistent with Ashley, that having young people be in groups and be able to have these discussions in groups and be accountable to other young people, that sort of creating structures that were co-created with young people around accepting the fact that they actually want to quit. We see a lot of this with people who talk about addiction to cell phones as well, but for whom the message of you've got to stop doing this is not working. So I think co-creating with young people and young people being able to coach and support each other through the journey is one of the things we see in a lot of the substance use interventions that are getting some success among young people. I don't know if you're seeing that among MindRight folks who are struggling with those issues.
Yeah, I would say it's pretty similar. The first step has always been guiding that member to want the help. That's the first thing. We can't, as we all know, we can't force people, but once they want the help, our goal is really to connect them with that specialized support. So that's when our care coordination team would be involved and connect them to the type of support they're looking for. But I think with cannabis or other substance abuse disorders that we've interacted with, we've also seen just, again, like members wanting to receive that treatment or support from providers who look like them, who feel like they understand them, who may have a level of just cultural understanding of their lived experience, so that way the judgment involved with substance abuse is a bit reduced for them to be able to fully take advantage. Yeah.
There was one last question back there, and then we'll wrap.
Who was it?
Oh, right there.
I'm sorry, I was yeah, my name is Ken too. I grew up as a dual status youth, meaning I was in the child welfare and the juvenile justice system. And so I just was curious if you all have anything in place as far as like standards or procedures for like kids in residential treatment centers and juvenile can receive negative consequences for speaking on needing help, right, by correctional officers or whoever. And when they try to advocate for themselves, that can kind of put them in a bad place. So do y'all have anything?
Yeah. Yeah, we don't currently serve any youth right now who are currently in facilities. We have served youth who have exited facilities or have been formally incarcerated. And so for us, I can't speak directly to the question that you provided, but we kind of help youth with reentry or what that, we've served youth who have been incarcerated in adult prisons and what that experience is like when you go back to school and people are looking at you a certain way of things you've seen and heard. So I think those conversations have been about addressing just the trauma and connecting them to support. But yeah, unfortunately, I can't speak to the actual when you're in the facilities and detention centers, what that's like. Yeah.
I really appreciate that question. I think it signals how much more work there is to do, which I think this room knows so well. We're totally out of time, but to wrap, can you raise your hand if you're building a solution in youth mental health? Can you? Okay. And raise your hand if you're supporting folks who are. Keep your hands up from the first. So I just actually don't look at us, look around, because we got a couple more days here together and find each other, because this room actually has a lot of energy and a lot of good things happening well beyond this stage, despite how impressive some of my favorite colleagues here are. So please find each other, and thank you for coming to this and being so attentive. We appreciate it.
Thank you, Katie.